Welcome everybody to this month's team brief. So today at lunchtime I gave a brief hospital update and then I covered our STP plan and meeting our strategic challenges. And then Anne Trail, our consultant nurse for infection prevention and control, talked to everybody about a very important flu vaccination. And then finally, Erica Heppelston talked to the team about the well-led governance review being conducted by Deloitte that you will all be hearing about. First of all, I'd like to remind everybody that it's staff survey time. It's that time of year again. Now, some colleagues would have received the invitation to participate online and others will have paper copies. That's completely random selection, so don't read anything into it. The other thing I'd like to say is that they're completely anonymous. We really don't look at them, so please feel free to fill them in and give your view. It's a great opportunity to help all of us in the organisation understand what our challenges are and try and respond to them. Now, some of you will have seen the invitations to go along to one of Heather Bixley's hot chocolate sessions. I'm going along on Monday and I look forward to seeing some of you there. Then I talked about the launch of our new clinical core standards. Now, this is a set of standards setting out how we as clinical teams will work together to meet the needs of our patients. Some of this has been very challenging, and some of it requires colleagues to work in a different way, taking responsibility and accountability for patients and their pathways, operating directly into the emergency department. And I know it will feel like a challenge, but it is the right thing to be doing, and it means that we'll be able to expedite our patients' pathways and give them great care. However, please share with us your experience of the implementation, how they're working, and we'll try hard to keep adjusting them and improving our approach. Some of you might have noticed the building work that started in the courtyard that backs off the main reception at St Peter's. Now, this building work is really important. We need a new endoscopy suite, and I'm afraid that is the only place it can go. The space there will be filled in, so there will be both building works, there will be noise, and ultimately the courtyard will disappear. I'm going to see the pathology team and have a chat about how we can make it more bearable for them. Last of all, we've been talking a lot about patient experience and how it's going to be, and already is in many ways, our driving ambition, delivering a great patient experience. And we've been doing lots of things to achieve that. One of the things some of you will know about is the Schwartz rounds. And yesterday, Farhana and Harriet and the team won a national award celebrating their innovative pop-up Schwartz rounds. This means that you can have a Schwartz round in your clinical area rather than leaving the area and coming down to Chertsey House or possibly the postgraduate centre. So it's a really great innovation. Great that they've been recognised in this way, and please, if you're interested in having a Schwartz round, contact Farhana or Harriet or a member of the team. And alongside that, as you will know, we are implementing I Want Great Care. This is a way of patients giving online, real-time feedback on the experience they've had with individual clinicians and practitioners in the organisation. Now, you will have all received a letter about this from David and Heather via your pay slips. Please take a look at it. And please try and come along to the launch date on the 12th of December, where the founder will talk to us about why it's important, how his package will help us, and his experiences of implementing it in other hospitals. So one of the things we've been talking about quite a bit is the Surrey Hartmans STP plan. And as I've described before, this is a way of the localities, Guildford and Waverley, ourselves, North West Surrey and Surrey Downs, coming together with all of the healthcare and social care providers in those localities to think about how we work together to meet the NHS health and social care challenge. That is more patients, increasing demand, patients who are older, more complex needs, alongside the challenge of a diminishing workforce and, of course, the financial challenge. Now, we've been working on this plan for some time, and we have now submitted the next stage of our planning last Friday, the 21st of October, to Simon Stevens, NHS England and his team, and that piece of planning work will now be assessed. Now, there's great opportunities of working in collaboration with our partners across the healthcare economy described in the plan. But alongside that, I've been thinking with the execs and others about how do we make sure we've got lots of things going on so that we can meet our challenges. And we've got a number of other opportunities, including working closely with our new community services provider, Central Surrey Health. We've got a land sale underway. We've got opportunities to improve urgent care. We've got opportunities to think about what the strategy is for Ashford Hospital and how we really define that clearly, and so on. So please, if you're interested in supporting any of this other work or hearing more about the STP or any of the other strategies, come and talk to us. Valerie Bartlett is the Deputy Chief Executive and lead for strategy in the organisation, and we'd be really interested to come along to your teams and have a chat in more detail about that.
Hello, my name's Anne Trail and I'm the Nurse Consultant for Infection Control here at Ashford and St Peter's. Today at Team Brief, I talked about influenza. I talked about the impact that influenza can have on patients and on our staff. And the key messages from my presentation were around staff vaccination for influenza, to try and encourage our staff to go along to occupational health and to access the vaccination to protect themselves and to protect our patients. So a clear action that came from today's presentation and discussions afterwards was the implementation across the organisation of having peer vaccination, where we can train key individuals to vaccinate their peers within their working environment to help make the vaccine more accessible to our staff. So details of this will be on the Trust Net. Thank you.
Hi, I'm Erica from the Quality Department, and I'm just going to give you a brief outline of what we discussed in Team Brief this afternoon in conjunction with the Well-Led Review, which is a review that the Board has commissioned in order to comply with our licensing requirements of NHS improvement. We're looking at how well-led the organisation is in the areas of operational, financial and clinical quality governance. This means that people from Deloitte will be coming round in order to speak with our staff to find out your views on how well led you think the organisation is. There's a chance to attend a drop-in forum which will be held in various venues around the Trust over the month of November, so that you can have your say to the external reviewers. And you've probably seen our leaflet which has been sent out in Aspire and also to your managers, and I'd encourage you to discuss that leaflet among your teams in order to look at some of the things the reviewers might ask you about the care you provide and the work that you do in your area. So this review will be taking place during November and December, and we'd really encourage everybody to take part in this review in order to showcase the wonderful care and treatment we provide at Ashford St Peter's.